Dehydration is something that we see commonly in children. Dehydration really just means dry body, and there's a number of reasons why this can happen. The first is not enough fluid getting into the body. This happens commonly when children are vomiting or if children are in a lot of pain and they're not drinking enough. The second common reason that children can become dry is that their body's losing too much fluid. This happens when kids have diarrhea, but it also happens on hot days when children are playing outside. When children are playing outside, they sweat. It's a way of controlling their temperature, but when they sweat, they lose fluids, and it's important that we make sure that they don't become dehydrated. One of the key questions that I often get asked is how do we identify dehydration in kids? And there's a few easy things that you can do. The first is just to ask the child if they're feeling more thirsty, and if they are, they probably need some more fluid. The second thing that you can do is look into the child's mouth. If it's nice and moist and wet, the child is probably not too dehydrated. But if you look in the mouth and you see that it's very dry, you have to be worried that they might be dehydrated. A third thing that you can do is actually check to see how much the child is peeing. One of the ways that the body controls fluids is to make urine. And if your body is getting very dry, your body stops making urine. So if you see that your child's not peeing or the urine is becoming very concentrated, you should be worried about dehydration. One of the last things I teach parents is to do something we call capillary refill. Sounds like a complicated technique, but it's actually very easy. What you do is you take your child's finger and you squeeze the tip. The tip should turn white when you squeeze it. When you release your fingers, it should quickly turn pink again. If it takes more than 2 or 3 seconds for that finger to turn pink, it may be that your child's dehydrated. The two things that are really important for preventing dehydration is what to give and how much. What to give seems like an obvious question to answer. We should just give water. And water is a great option for kids that are dehydrated. Unfortunately, when children are sweating, they're not just losing water, they're losing salt as well. And there are a number of commercially available rehydration fluids that contain not just water, but salt as well. And these are safe to give in children. In terms of amounts of fluid, if you're worried that your child is becoming dehydrated, you may need to give them 2 or 3 times the amount of volume that they normally take. If you're worried that your child is getting even more dehydrated or not responding to you normally as a caregiver, then you want to think about bringing your child to your local urgent care or emergency department.